Porcelain veneers is a way to create the most gorgeous smiles in dentistry today. They're basically small little thin wafers of porcelain that look so real to the naked eye that you cannot tell they are not real. It's probably the only fake body part in all of medicine that is so perfect that it's hard to discern between a real tooth and a fake tooth. And just like veneering a cabinet, like an old piece of furniture, you can take a small piece of porcelain of fingernail thinness that can be 0.5 millimeters thin, thinner than a fingernail, and placed over the surface of the tooth and create a beautiful, healthy, natural looking young tooth. And I wrote about this maybe in 2005 or 6 that porcelain veneers are probably unavoidable in your lifetime if you're trying to get a perfect smile. If you want your teeth not to look aged, worn down, discolored, you want to have a youthful look, you need to get porcelain veneers. It's the ultimate cosmetic restoration. I've been a dentist for 33 years. I've been doing them for so long that I realize that they last. If placed properly, they could outlive you. We don't like telling patients that because anything man-made doesn't last forever. But the technology of porcelain veneers is so excellent that when done properly, you don't have to worry about them. They're in my mouth. I eat whatever I want. I say whatever I want. I do whatever I want. I never even think that I have porcelain veneers in my mouth when I'm eating. And it's just an incredible procedure. And I've been doing it since the 90s. I was one of the first doctors to really jump on the bandwagon during the extreme makeover days. And I was really gung-ho about making smile makeovers. And since then, I've been doing so many of them that it's almost effortless for me to create a perfect smile. I'm an artist, I'm left-handed, and because I became a dentist when I was only 24, it's almost effortless for me to create a gorgeous, long-lasting, beautiful smile. How we do it is we generally start with a picture. We take a picture of you smiling and we can image in a new smile over your smile with a simple imaging software. We can look and see what it would look like to have porcelain veneers in your smile. We can also take an image of your teeth and make a template of a perfect smile, and we can try that on over your smile. We also do that when we create perfect white smiles because we want to make sure that we understand what the patient likes. So there's some smiles are very oval and rounded, and some are very squared. And so people have different styles that they love, and we want to make sure that all our smile makeovers are exactly what the patient wants. We look at color. How white do you want them? Well, some patients want them super white. Other patients want them very natural looking, like a natural light color. And we have ways to make sure that you get exactly the smile that you dreamed of having. It can happen because the way we work at Perfect White Smile is so perfected that it's almost impossible not to get the smile that you love. You wear a trial smile even before the porcelain smile is made. And so say a tooth was too big or too small, we can shape it and contour it while you're still in the trial smile and make sure that the lab technician gets exactly the shape and contour that you desire. When it comes to color, we put a nice color in, and a patient will say, well, I want it even whiter than this, or this is too white, I want to tone it down. From that, we can actually figure out which color is best for you and which works best with your skin tones and with your face and with your whole look, so that we can perfect any smile that's out there. So that's how we do it. There's different types of porcelain veneers. There's some veneers that are very thin prepped. They're called lumineers, is a brand name, which is a very thin veneer, which sometimes you don't even have to prep the teeth. A person who's a good candidate for a no prep or a minimal prep veneer, meaning that we don't need to really reshape or recontour the tooth, is someone with small teeth, someone with gappy teeth, because then we could place these porcelain delicate veneers over your smile and you don't have to do much underneath. If someone has very crooked teeth or very large teeth and they want to make them a little smaller, then we would need to do a little more reshaping and recontouring before we actually have the lab technician design the smile. It takes 2 visits normally to do it. We say 2 major visits, meaning that it's 1 visit to us to prepare the teeth for porcelain veneers for them to accept a veneer that will last a long time. And the second major visit for us to install them and put them in so that they last for a very, very long time. That's generally how we do it. There's minor visits along the line. We do numb patients, so we get them on local anesthetic so they don't feel anything during the process. We make sure that if they even wanted to sleep or be sedated, they could, if they'd like to. We try to make the visits as comfortable as possible so that it's a pleasant experience to get the smile of your dreams. When patients come in, I ask them, like, how do you like your smile? What is it? And they'll say to me, I love my smile. It's very rare that I would hear anything other than that. I mean, a new smile can change people's lives. We've had so many patients come in, I don't even recognize them. They lose weight, they change their hairstyle, and they've improved their image so much by having a new smile that it makes me feel good in the heart when I see people really enjoying their new smile. I get patients who come in for weddings constantly. It's huge for a bride and a groom to come in and have smile makeovers done prior to their wedding. I've had a husband tell me it was the single best investment they ever made was to get the smile done on his bride, because he still sees it. The wedding lasts 1 day, the smile makeover lasts throughout their marriage. And it's the greatest investment you can do. I get lots of businessmen that come in and lots of people that want to just look better for their self-image at work, private life. You get people from all types, women, men, who want to improve their smile to look better for either work reasons. Lots of actors, lots of people in businesses that involve being in front of a camera or in front of people. A lot of lecturers want to have their smile perfected. And it's a no-brainer. I'll look on television, we'll see people with horrific teeth and we'll say, you know, it takes 2 visits to get this procedure done. What is this person waiting for? And there's no reason. We think that when young people come in who have smiles that they want improved, we think they're geniuses because they get to live and enjoy that smile so much longer than someone who comes in their 60s, 70s, and they wore that smile that they never loved for so many years. But there's no better time than the present. And if you do it at any point in your life, I think it's a great move. Just so you know, I mean, it's very biological porcelain veneers. We don't use any chemicals when we bond them on. It's like Velcro, it's like a mechanical lock. It's 2 rough surfaces that come together. They actually strengthen your teeth. They actually make them stronger because it's having like a little bit of a shell over the tooth that protects them. And they actually improve the longevity of a tooth. And when I look at porcelain veneers that have been on patients' teeth for 10 years, 20 years, the body loves them. The gums are healthy around them. The gums are nice and pink, and the tooth shines, the light shines through them naturally. They're translucent, they don't look opaque, they don't look fake, they look like real teeth. And patients, never look back. Every single person who I've ever treated has told me that they love their smile and that they're so happy that they did this. It's something that I'm passionate about, something I enjoy doing, and something that I love doing. So that's why I like to talk about porcelain veneers. And if you haven't explored them yet, if you haven't really looked into like the technology and how they work, I'd love for you to come in and have a consultation. Let's discuss things. So if you're interested in contacting me, come to Perfect White Smile. You can email us at reception@perfectwhitesmile.com. You can email me personally if you'd like at drfrey@perfectwhitesmile.com. Very easy to get a hold of. We're friendly people, and we're happy to help you if you want our help.